Assalamu alaikum everyone. Today I will be presenting a published case study that is fetal maceration and retained fetal bones in the mare. And actually, this case was published in the Journal of the American Veterinary Medical Association in 2019. And first of all, we are gonna discuss the case overview. This case actually involves a 10-year-old multi-paras quarter horse mare weighing approximate was 500 kilograms, and the mare was admitted to the Mare Veterinary Services Equine Hospital following abnormal findings during a routine pre-breeding reproductive exam. And overall, she was in a good physical condition, and nothing, any kind of signs related to the systemic illness was not found over there. The next part that we have to discuss that was related to the clinical history. Actually, just 4 days before the examination, the mare was given close prostranol and was in a stress during the exam. In the previous breeding this season, she has been confirmed pregnant at the 28 days, but she never foaled. The owner did not observe any signs of the abortion and assumed that the fetus had been resorbed. On a physical examination, actually, the mare appeared healthy and with no vulvar discharge or abnormal finding. Nothing what this kind of scene was seen over there. And the next procedure that was performed, that was the reproductive examination. And during the reproductive examination, transrectal palpation revealed actually a non-gravid uterus with a relaxed cervix was there, and there was asymmetrical uterine horns, and the left horn was actually, they had seen that was enlarged, and the ultrasound revealed a dominant 35 millimeter follicle on the left ovary, and they had also observed moderate uterine edema, and ultrasound also revealed the luminal fluid about 4 centimeters deep that was consisting of hypercoic linear structures, and these findings actually suggested an in uterine abnormality, possibly remnants of the fetal tissues. So the next part was related to the diagnostic question. At this stage, the main that question that arose there: what diagnostic procedure could further identify this in uterine abnormality? And if we think about this one, the answer would be the hysteroscopy, which allows us to directly visualize and help us to get the visualization of the uterine cavity. So the next pause was related to the diagnostic procedure. The mare was sedated with the ritomidine and the buterphenol, and after aseptic preparation, a video endoscope was carefully passed through the cervix into the uterus, and air was used to gently insufflate the uterus, providing a clear overview of the interior. Upon advancing the scope to the base of the left uterine horn, they had observed elements of the fetal skeleton and confirming the diagnosis of the retained fetal bones. So, after all this diagnosis, the next part was mainly related to the treatment. So, to remove the fetal remnants, an endoscope snare was introduced to the scope's biopsy channel, and large fragments, including the skull pieces, ribs, scapula, sternum, and ilium, were retrieved manually after being repositioned to the cervical opening of the animal. And the uterus then actually lavished with 3 liters of isotonic fluid to flush out the smaller bones over there. And in the post procedure, the mare actually given the oxytocin, flunixin, and a 5-day course of the oral trimethoprim sulfa antibiotics. And the next part that we have to discuss, that was related to the case study, that was actually the follow-up examination. A follow-up hysteroscopy was performed the next day to confirm the complete removal of all the fetal remnants, just to confirm that nothing has been left out regarding the fetal remnants over there. The uterine lining appeared healthy with no residual bone fragments were there, and the mare recovered well, was discharged after 3 days, and the continued antibiotics at home. And she was advised to rest for the remainder of the breeding season. And now we will be gonna discuss the main discussion part of this case study. Actually, the fecal maceration is a rare occurrence in the mare. It usually develops when a fetal dead fetus is retained in the uterus during the mid gestation. Bacterial contamination normally accelerates the autolysis, and they're leaving behind partially mineralized bones that resist the resorption. And the main contributing factor that enhance this actually include the uterine inertia and the fetal mal positioning and the cervical rate overall this process. And if this case would be untreated, retained fetal bones can lead to the chronic endometritis and irreversibly endometrial fibrosis can occur that will severely affecting the fertility of the animal. And uh, uh, and the next part that we have to discuss that was related to the comparative case notes. In previously published cases, most may show vaginal discharge or clear sign of abortion. However, if we compare this case to the others, this mare had no discharge and no non-abortion, making diagnosis more challenging. The use of the hysteroscopy in this case was crucial. It allowed us direct visualization, diagnosis, and the guided retrieval of the fetal bones, preventing more invasive surgical intervention. And the next part that we have to discuss that was the outcome and the prognosis. The following breeding season, the mare was reevaluated. Her uterine culture and cytology results was normal, and she was fully successfully bred. A pregnancy check at the 16 days revealed a single embryonic vessel, and she eventually gave birth to the healthy live foal, indicating a complete recovery and a reproductive prognosis that she have been recovered from the scenario that causing the abnormality over there. And the next part that we have to discuss that is related to the key takeaways. This case in highlighting the three key lessons. First, always perform through the breeding exam, especially in the mares with the history of the fetal loss. And secondly, hysteroscopy is an excellent tool for diagnosing and treating intrauterine abnormalities. And third, early reduction and appropriate management prevent long-term fertility issues. And the last part that we have to discuss that is the references, and that have been mentioned over in the PPT over there. And normally, I hope this whole case study would be helpful for us to discuss about and understand these kind of situations. And I hope you will like the presentation overall. And okay, thank you so much.